Today I'm going to be demoing the Hydrafacial Plus for you. Okay, this is the Hydrafacial machine. You'll see all of the products are always kept in here, so when you are setting up for your treatment, it's going to be very easy as far as that goes. If these ever run out, you will just grab an instructor and they will replace them for you. When you push this on button, that means that the specific product is turned on. So you'll see right now, all of these are off. I only have this one on. So while you're treating, you want to make sure you just have one product going at a time. As soon as you're done, you're going to flip it off. In order for it to go through the tubes so that you can actually apply it onto your client's skin, you're going to hit the on button right here. You'll hear that noise turn on, and that's actually the suction going that's helping to dispense the product. And as soon as I hit off, that flow is going to stop. Up here with these two dials, you'll see there's an addition sign and a minus sign with a number in between. That is going to control our suction. What is recommended is anywhere between 14 and 18 to begin. We have found 16 is pretty ideal, but make sure you're communicating with your client. So if the suction is too aggressive, you can turn it down, or if maybe they want a deeper exfoliation or they have some deep extractions, you can also turn it up here. When I move on to each step, I'm just going to make sure that I only have that one section on. Whenever you are doing system rinse, this is to clean out the tubing. You're going to want to make sure that your handpiece has the cleansing cap. So this is a cap from a treatment, but when you apply your cleansing cap, you'll see it's closed at the top. So the solution is all going to stay inside, and make sure that it's completely sanitized. We'll place that back here. But you'll see or hear again that same sound because it's getting all of the product with the suction from our system rinse, and it's going to run it through the tubes. To end the treatment, we're going to have it run for about a minute to a minute and a half. So we're going to let that run. With your handpiece, this is where your tips are going to go on. There is an O-ring, and that is where your tip is going to stop. Your tip is never going to go past that O-ring, so don't feel like you need to keep applying more pressure to get it to move down. You'll also see a plus and a minus sign here. That's going to control this dial. It's going to control your flow, so you can adjust how fast or how slow you want your product to be coming out. When you are applying your ampules, you're going to want to twist this gray button to the unlock position and just pull straight out. Your ampule will then just click right in. The last thing to show you is here on the side, you have your canister. This is where all of your product is going to go. So during the treatment and then at the end of the treatment when you system rinse, you're going to find it in there. So it's any extra product, but then also any debris from your client's skin. So if they've had makeup stuck in the pores or extractions, you're going to see that in the canister. Some clients like to see it, so if you'd like to show them, that's totally up to you. And that is our Hydrafacial machine. Alright, today we are going to be doing our Hydrafacial Plus. I'm going to first walk you through our tray. So for safety, we have goggles for our client and gloves for ourselves. We then have the actual Hydrafacial supply. So we have our tip kit. This has all 3 tips that you're going to need for your treatment. There is also a kit that has an orange tip, and that's for a deeper exfoliation or a more aggressive Hydrafacial. Then I have our Glycol. This is for the peel portion or exfoliation portion of the Hydrafacial. We're going to be doing the Hydrafacial Plus, so I have the 15% today, and then I also have a booster of your client's choice. So after you have had your consultation with your client, you will decide on which booster is best for them. I also have our soft gauze to perform our first cleanse, 2 sponges to neutralize the chemical peel. And then my products, all I'm going to need, because all of the products are part of the Hydrafacial machine, I really just need a cleanser and then also a moisturizer for the very end. Some of your clients may leave and feel completely moisturized, and it may not be necessary, but we recommend grabbing it just in case. So this is our TNS Ceramide Treatment Cream. And then I also have a bowl of water. Okay, we're going to go ahead and get ready with our client here. We're going to start by wrapping up their hair. Now the headband covers her hair really well, so we're just going to leave it. Do make sure that you pull the headband down so at least you're along the hairline. You want to make sure that you're treating the full face. And we're going to go ahead and start with our cleanse. We're first going to sanitize my hands. Okay, I just sanitized my hands, so we're going to go ahead and cleanse. I'm going to perform a clinical cleanse today, so I have gauze wrapped around my fingertips. Just scoop out my cleanser. We perform a clinical cleanse just so we can make sure that we are doing a thorough cleansing job of the skin. So that way, as we're performing the Hydrafacial, it can penetrate a little bit better and give us a better result. Okay, we'll go ahead and rinse the cleanser off. Again, I have my fingers wrapped in gauze, and we're just going to remove the cleanser or any leftover residue. Now, the first step of the Hydrafacial is actually a cleansing portion, so that's just more stripping, so we can really remove any extra oils or dirt or debris from the pores. So we just do one clinical cleanse to begin our Hydrafacial. All right, we are ready to begin, so I'm going to start by putting on my gloves. Okay, I have my gloves on. I'm now going to place my client's goggles to protect their eyes. And then we're going to get our tips ready. You are always going to have 3 different colors of tips. The only one that's ever going to change is this blue one. If your client wants a more aggressive Hydrafacial, then you can switch this out for an orange tip. You will always have a turquoise and a clear. So we're going to stick with these 3 today. I always like to think of going darkest to lightest as far as my order goes, and I also place them in that order. Okay, so I have now attached my blue tip to the Hydrafacial handpiece, and I've turned on our machine. I have my suction at a setting of 16 after I had a consultation with my client. I want to make sure that I'm going to occlude this handpiece, and it should take about 3 to 5 seconds to fill up the tip with product. So I'm just going to occlude that onto my gloved hand. And if I'm not finding that, then I'm just going to adjust here to get a better flow. All right, we're gonna go ahead and begin right here along the jawline. For my first step, we're going to do 3 passes that are, it's about 1 inch, maybe 2 inches, and then move on to the next section. If you see that there is a lot of extra product that is starting to drip down the face, just again, adjust your flow. This is a very fast step. Again, this is our cleansing step that I had mentioned previously. If you ever feel like the flow is coming out a little bit slower, just take a quick pause and occlude it on your glove again to make sure that you're getting an even treatment for your client. You also want to have your client turn their head, and that way it's a little bit easier on your hand or wrist. Along the eyes, we want to pull down the skin as much over that orbital bone as possible so that we can treat it. We really don't want to go too high with the suction. It can just be a little too aggressive, so try to pull down as much skin as possible. Okay, we're then going to go onto the forehead. You'll notice that all of this was horizontal besides right here along the temple. Same thing with the forehead. Right here on the glabella, we're going to go vertical. As soon as we reach the eyebrows, we're going to move horizontal. The forehead is probably the area that is going to be the trickiest to get suction. So it will take a little getting used to. Just make sure you move your handpiece around so you can find what works for you. Okay, we've now treated one whole half of the face. We're just going to repeat all those same steps on the opposite side. Now you can probably see these hoses a little bit. I try to keep the hoses over my shoulder or my arm as much as possible. Sometimes they definitely will fall, depending on the area that I'm treating, but that's the easiest way to kind of keep them out of your way and away from hitting your client. You really don't want them to touch your client for comfort reasons, but also for sanitation reasons. Now to treat the nose, you're going to, most of the time I would say, work down, but depending on the client's shape or size of the nose, you can move your handpiece however you need to make sure that you get complete contact and that you're thoroughly treating the area. Okay, this is the only step that we're going to perform twice, so we're going to repeat that whole thing. One thing I want to show you is if your client is really dry or you're struggling to get glide, you can start by just applying product. So let's say I was going to start on the jawline. I could do 3 quick dabs to get some product application and then go ahead and proceed. That's not always necessary, but if you're seeing that you're struggling to get enough product on there, your glide is kind of stiff, that's just a little trick that can help you. So we're going to go ahead and complete the second pass now. Our clients that are used to a regular facial, this generally isn't like a very relaxing treatment. Your skin is going to be glowing, it's going to feel great, but sometimes just make sure people understand this isn't a treatment that they're going to want to generally take a nap. It doesn't hurt, but it's not comfortable, and so just make sure that they're aware of what they're getting into. Again, there is no pain involved, it's just not a relaxing treatment. Okay, and that completes both of our passes now. Okay, these tips, you just want to make sure that you give them a small twist and then pull straight up. You don't ever want to bend them to get them off. There is a small piece in each tip that can get stuck, so just make sure you pull straight up. I like to use a towel, as you just saw, because it helps me to grip on and it just comes off really, really easily. The tips are all disposable, one-time use, so make sure you just go ahead and throw that away. And then we're going to go ahead and move on to our second step, which is using our turquoise or teal tip. So again, I'm just going to place that right on. One thing you probably can't notice really well on camera, but there is a small gap between the tip and the handpiece. That's totally normal, so don't try to keep pushing it down. It's not going to go any further, so it's really normal to see that small space. All right, our next step is actually our glycol, which is our exfoliation portion. So you'll see here there's an unlock and a lock. I'm going to unlock this gray part and just pull it straight down. And then we're going to insert our ampule that has our actual glycol product in it. So this is a 15% glycolic and a 1.5% sal. Just push that in, you'll hear just like a small click, and you'll know you're in place. Okay, so again, start by occluding. You want this to take, again, about 3 to 5 seconds to fill up. Once you know that that is sufficient with the flow that you have, you can go ahead and begin. With this movement, you're actually doing really fast, what we call a feather stroke. So I'm not really getting the product that I want. So again, I'm going to occlude. The sound I want to hear is almost the sound you would hear coming out of a straw. And I just watch the skin really carefully to make sure that I'm getting the amount of product I want. Okay, now that I'm getting the flow I want, and sometimes it takes some adjusting, and I'll even adjust as we're going. But you'll see I'm not focusing on my overlap. I'm just doing small feather-like strokes to get the peel all over the client's face. Again, pull down the skin as far as you can over that orbital bone so it can get treated. And you're just going to continue on with these feather-like strokes for the whole face. You also will want to check in with your client with this portion because they may notice a little bit of a sensation from the chemical peel. Is everything feeling okay? Mm-hmm. Now, if you have a thorough application, you should only need one pass with this peel. If you notice that there's an area that's dry and maybe you missed it or didn't treat it, then just go over that small area. Okay, and that's your second pass. Okay, so we just finished our Glysal portion. I have taken off my ampule and put on my gray tubing so that I can get the products from the machine. I'm going to leave my turquoise tip on still, and we're going to go ahead and flip on our Beta HD. Now this step is to help clean out the pores. So you're mainly working along the T-zone or any area that your client has breakouts, so make sure you consult with them first. You can also spot treat, and I'll show you how to do that as well. Do you have any areas of concern, client?
My cheeks.
Okay. So what we want to do to make sure that we're cleaning out the pores is to do a really slow stroke. I like to think of vacuuming. The slower you go, you know you're going to get everything off of the carpet. Kind of the same idea here. So really slow strokes over those pores to clear them out and to help kill any bacteria. Now with this, you really just want to stay in communication with your client. If you see that they're getting really irritated or really red, just talk with them, make sure they're feeling okay. So I see one little blemish here. So if I were to spot treat one small area, I'm going to apply pressure to the one blemish and give it a little twist. And that helps to just target that one spot. We'll go ahead and do the other cheek now. Now our client is really lucky. She doesn't get a lot of congestion along her nose, but I want to show you this tip will just go right along anywhere on the nostril. So when people do get a lot of congestion on the nose, you can just come right here on the edge with that tip. And again, I'm not applying any pressure, but it's going to just clean out all of those pores. The trick is to go slow and again, not add any pressure. We have suction with the Hydrafacial machine, so it should do everything for you. You really shouldn't be applying pressure on any of the steps. You also can go any direction that you need to. This is also great if you want to go over the lips or around the lips if they have any small blemishes there. Okay, we're done with the Beta HD now. So we're going to turn the machine off, and now we're going to go ahead and neutralize the skin. So I'm going to take my 2 sponges and dip them into the water and just neutralize her skin. While it's neutralizing, I actually want to clean out the system as well. So I'm going to turn on our system rinse and have it rinse through the tubes to help sanitize those tubes. It really only needs to run for about 30 seconds, so take about 30 seconds, blot the skin to neutralize it, and then you'll be done with both and ready to move on to the next step. Are you feeling any activity?
Nope.
Once your client is feeling 0 activity, you can be done neutralizing. This is totally going to depend on how thick or thin or sensitive your client's skin is, so just make sure that you're communicating with them. Okay, if you were doing the original Hydrafacial, you would now move on to your last step, which is your Antiox Plus. We are going to be doing the Hydrafacial Plus, so there's one extra step we're going to add in right here. But again, if you were just doing the Hydrafacial, you'd move straight onto your Antiox. So we're again going to move to the unlock position, pull this straight down, place it back onto our machine, and then we're going to put on our ampule of choice. Again, this was based off of our consultation, so we're going to use Brighten All. This helps to even out your client's complexion and help with any pigmentation. I'm also going to change out my tip at this point. So I'm going to remove my turquoise one. Remember, just use a towel and pull straight up. And then I'm going to put on my clear tip last. Again, all of these tips are going to leave this small gap, so don't be alarmed by that. All right, we're going to turn our suction on. Make sure that the product has a nice flow for us. Perfect. Okay, so this move is called the kiss and twist. We just apply pressure and give a small twist. Again, I'm not applying any pressure. This just helps the booster product to penetrate into the skin even more. I'm just going to do horizontal rows along the whole face. Your clients are going to have 3 different ampules that they're going to be able to choose from, or booster. So we have this one, the Brighten All, that's going to help with evening out their complexion. It will help with pigmentation. We also have a growth factor booster and also a peptide blend. So if your client is more sensitive or aging, then that's going to be a great one for them. Or even someone with dry skin, that peptide blend is going to make their skin feel nice and firm and help diminish some of those anti-aging factors like your fine lines and wrinkles. Now it is normal with this step, because we do that little twist, to be able to see a small imprint of the tip. And again, I'm not applying any pressure, but it's because of that added twist. They are going to go away within about 15 to 20 seconds, so don't be alarmed by them at all. It's very normal. Okay, we're just going to continue on to the second half of the face. I'm repeating the exact same thing. One thing I have noticed with the ampules, the flow doesn't come out very even, so you'll see I stop quite a bit to occlude it on my glove. That's just because I want to make sure I have an even flow. I also adjust on my handpiece a lot, because your hand is moving multiple directions, and so your flow can change and adjust. So I'm just always watching that. I don't want my client to get a better treatment on the right side of the face versus the left, or their cheeks don't get a good treatment. So just make sure you're always checking that flow. And you can see the skin glistening from the product, so you can quite easily see where it hasn't been treated, or if your flow stops even. With this step and even my next step, I'm doing about a 10% overlap, so that way I know every centimeter of the skin is being treated. Another little trick, if there's an area on the nose that I just cannot get suction, I still make sure that the product is still getting applied to that area. So you'll see I'm rubbing in some areas right along the bridge of her nose is quite bony and thin, so I'm not getting the suction I want. So I'm just moving the product to that area so it's still getting those benefits of the product. Okay, with the boosters, you only do one pass. We're gonna go ahead and turn the suction off and then move on to our last pass, which is our Antiox Plus. So remember, I have to take out my ampule. I have product left in there still, so I'm just gonna put it to the side. And then we will lock this back in place. I'm gonna leave the clear tip on. So if you've noticed, the blue tip is on for 1 step, the turquoise is on for 2, and the clear is on for 2 if you're doing the Hydrafacial Plus. If you're just doing the original Hydrafacial, the clear is only on for 1. Okay, again, we're gonna go ahead and occlude, make sure I'm getting a nice even flow. Now with our last pass, all we're doing is a stamping technique. This is the one that we find we generally want to apply pressure, but again, just let the machine do it for you. So I'm just doing slow stamping motions, again doing horizontal strokes, and I'll cover the entire face. It should sit for about 1 to 3 seconds. Again, with every single step, you'll see me pulling the skin over that orbital bone so that I can treat as much of the skin as possible. Now I noticed here it was a little dry. I didn't quite get the flow I wanted, so I'm just going to retreat that small area. Another trick with this, while you're getting used to the machine and the flow of the product, is to put a cotton ball in your client's ears. Sometimes the noise bothers them, but more than anything, sometimes it can drip into their ear, which is why you see me wiping all the time. So having a cotton ball is just a little safety guard for you. Now this is just a 1 pass as well. If your client is soaking it right up, or you're seeing there's just a dry spot, then you can definitely spot treat any dry areas. But generally it leaves quite a nice glow and will just absorb slowly into the skin. I also like to go over the client's lips if they want it done. It can help to hydrate the lips, but it also gives it a nice little plump. Would you like your lips treated today?
Sure.
Just instruct them to keep their lips closed. I'm going right along the lip in that vermilion border. Okay, we're done with that pass. So we're just going to kind of pat in that Antiox Plus. And remove her goggles so I can make sure we get everything to absorb.